Well, good afternoon and thanks for joining us on this day. I'm going to start with some positive news today, which is that 24 people across our local health district have actually recovered and are no longer positive for COVID-19. Unfortunately, we have to go from a positive straight into a fairly large negative today. Up until 8 o'clock last night, 49 new cases have been discovered across the health district. 35 of those are in Dubbo, 7 at Bourke, 5 at Orange, and 1 each for Narromine and for Walgett. That means the total number now for the health district is up to 369. Dubbo has 294 of those currently. Scott will talk a bit more about the period of infection in the community and also go into a few of the details around transmission in itself when he speaks. Almost 6,000 tests have been conducted over the past 24 hours. That's a drop again from what we had yesterday. So again, the plea is around testing. We know it can be difficult for all sorts of different reasons, but testing is how we actually find out where people are positive. So 6,000 tests across the whole region for the past 24 hours is a bit of a drop. We know where there have been an uptake in cases at places like Parks. There's been real interest in getting a test. We want to see more people turning up everywhere with even the slightest of symptoms, or if you have a concern, and the concern might be around where you've been, as in visiting a venue of concern. If you have any of those concerns, please do go to your nearest testing facility and get that test. We really need people to keep doing that. Of course, all of our testing facilities remain open. Just a note, Wellington has now moved, so the Wellington testing facility is actually happening at the Civic Centre. It's open there every day, 10 till 4, so that's every day of the week, 10 till 4. And please share that info with family and friends around the Wellington area that may not know that. That has moved as of now, so it's an all-weather facility to cater 7 days a week between 10 and 4 for testing at Wellington. Of course, the vaccination pop-up, it's happening right now at the Dubbo Regional Theatre and Convention Centre. Again, just to give the Pioneer Park a chance to dry out a bit. We'll update you on exactly what's happening for tomorrow. But that clinic is running through, importantly, until Sunday. Opens at 9 and finishes at 4:30. Again, today people lined up from quite early, so it is an extremely popular clinic. Be aware that you do need to be distanced when you're lining up. You do need to have a mask on. There have been several people that are thinking they can line up because it's outside without a mask on. When you're waiting for your possible vaccination, you need to have a mask on. You need to be distanced from people. You need to be patient. It can take a few hours. That's the reality of it. But we need you to think about other people around you at the same time and keep coming along. Of course, that's not the only place to get your vaccine. Either way, you need a Medicare card if you have one, your independent health identifier if you have one of those, if not just some form of ID, so you can actually get the jab. And of course, the ADF teams, our healthcare teams, are spread right across the district at the moment. So from today, Narromine underway, so 2 days of jabbing there today and tomorrow. Bourke and Parks both again into their second days today and again tomorrow. And then we've got Brewarrina, Trangie, Peak Hill starting on Friday. We'll have more details in this particular post, but there are a lot more towns obviously still to come. Not all of those details are available as yet. So towns, for example, that we're going to be visiting as of next week, some of those details like the times and the exact locations for places like Nyngan and Mudgee and Golgong aren't yet up. As soon as they are available, we'll let you know, but basically put in the dates so you know there will be a clinic in your town on that day. We'll update you with exactly those details a bit closer. And again, if you can just keep the people in your circle, your friends, your family, involved in what's happening, keep reminding them about those dates, that'd be much appreciated. The other thing we want you to do is if you are coming to a walk-in clinic, make sure you cancel any other appointments you might have. So whether that's with your GP or pharmacy or the actual vaccination clinic, make sure you cancel, because we've had a few scenarios now where pharmacists, for example, and GPs have had time booked out for vaccinations and people haven't turned up because they've gone to a walk-in clinic and they discover that later. Really important to make sure you share that information and let them know so they can keep booking others in for the vaccinations. Wellington, of course, has its own vaccination clinic. It's running 10 till 4 Monday to Friday. It is bookings only. Just a reminder, 6845 5423, that's only open again during business hours. It's been going extremely well. Big thumbs up to all the crew at Wellington. 283 vaccinations in the past couple of days. That's fantastic work. We're really pleased with all of the support that the community's providing, and a great job, a really good collaboration happening there. That's still running as a booking only. We're still, I guess, looking for ways of possibly making that a walk-in, and that'll be looked at over the next couple of days. And just a reminder, and Scott will talk about this a bit more, I'm sure, there are more appointments available. The pop-up clinics are there to help try and get a big number of people as quickly as possible vaccinated, but there are so many other ways to do it, and we're really encouraging you to keep doing the booking system. So we've got the main vaccination booking clinic that's run out of Dubbo. That's the one that had been at Monera Plaza, now at the Woolpack Pavilion at the showground. So bookings are popping up for availability of that all the time. That's both Pfizer and, importantly, the Oxford University vaccine, AZ. It's really freely available. We want people to start booking and continue booking. That's a great way to keep those numbers flowing. And entry for that will be off Wingewarra Street near Chelmsford Street. Bookings only. Remember, you can't just turn up there. There's been a few people trying that. That won't work. And use the eligibility checker, or there's the 1-800 number, 1-800 571 155. Your GPs, your health clinics, the AMS, and of course pharmacists that have lots of availability. We're encouraging you to reach out as much as possible and keep booking those appointments as well. That's a great way to make sure we keep on top of things. Shopping, I've mentioned, we're still looking at helping out the supermarkets particularly as much as possible. Remember, if you're clicking and collecting, there will be waits sometimes. There will be a bit of planning required on your part. Supermarkets are doing their very best, and we're doing our best to help them. If you're going to the shops, we really just want one person from the household, if that is possible. If you've got to take kids, we understand. If you need a support person, obviously, we understand. You need a mask on. You need to sign in. You need to respect the staff and thank them for what they're doing as well. I do want to give a shout out today. I've had a couple of phone calls recently from some of our amazing community nurses and aged care nurses who are literally every day out and about in the community, doing a job that's difficult at the best of times, particularly difficult in trying times like these. They're the front line. They're often copping a bit of abuse as well. It's a really important part of the service that our community has, is caring for people in their own homes. And you know, it's a tough thing to do. So I just want to say to all of you community nurses, all of our aged care nurses that are out and about, you're doing a top job. We really appreciate you doing what you're doing. COVID's making things far more difficult. People are a bit grumpy about all of that as well. So thank you for doing what you're doing. If you'd like to give a shout out, we'd love to hear from you as well and recognise some of the really important people in our community. So get in touch on that. Again, lots of information. More and more people are trying to find as much out from this post or other posts and through the New South Wales Health COVID website. Please continue to do that. We're trying to keep up with the demand for questions, and we will continue to. And of course, the number one message is we are all in this together. There's been a great collaboration. Dubbo Regional Council and the Mayor, Stephen Lawrence, and the CEO, Murray Wood, are both here today again, collaborating all the time and working with police and health to make sure this is the best possible response it can be. Keep supporting each other, and I'll hand over to Scott.
Thanks, Dougal. Well, I've got to say it's an extremely concerning day to see a record number of cases identified across Western New South Wales. 49 new cases identified in the last 24 hours to 8 p.m. last night. That takes us to a total of 369 cases right across the whole of Western New South Wales. And it's definitely getting to an extremely concerning level. Out of the 49 cases, 35 in Dubbo, 7 in Burke, 5 in Orange, 1 in Narromine and 1 in Walgett. Now, out of those, we've got 28 of the 49 have got known links to other cases or a transmission point. 21 of those are household contacts, and 7 others have links to known clusters. And we've still got around 21 of those under investigation, so I expect that number to change. Out of the total 49, we know that 8 were definitely infectious in the community. 20 are still under investigation. Now, out of the 49, there was none of the either Burke or Narromine cases were infectious in the communities. That takes our totals across Dubbo to nearly 300 cases. It's still around 80% of the total cases across the region, but nonetheless a real concern in Dubbo. There's significant growth in cases. Can I please urge everyone in Dubbo, the stay-at-home requirements, testing as soon as you've got any mild symptoms, however mild, and please stay apart from each other. Do all of the things that have kept us safer through the last 12 and 18 months. They're ever more important now. We've now got over 110 venues of concern. That list continues to grow every day. Can I urge everyone to please keep an eye on the New South Wales Health website. Those locations are really crucial points where we know we haven't made contact with everyone that was in the facility. Quite often, some of those notifications will happen very quickly and in advance of the owners understanding that that's happening, because there's such a significant risk to public health and concern. The sewage testing, we don't have any new locations in the last 24 hours that have identified positive fragments in the sewage where we don't have cases, but we did get one positive back for Gilgandra and Orange, and no surprises in those. Now, really concerningly, again, we saw a decrease yesterday in the numbers of people getting tested across the region. Now's the time, everyone, please, I'm begging, come and get tested if you've got any signs and symptoms, however mild, any concerns. There's a lot of testing opportunities available. We saw around 2,400 in Dubbo, Mudgee 154, between Bathurst and Orange, neck to neck, but competing with each other, 1,046 in Bathurst and 1,042 in Orange. I'd love to see those numbers double, knowing the numbers of cases in those communities that have been positive in the community. Now's the time to be really vigilant in those towns and around those towns. Parkes 344, Wellington 81, Burke 86 and Forbes 217. As Dougal mentioned, all of the testing locations will continue right through the rest of the week and over the weekend. They're readily available. Please come and get tested if you've got any signs and symptoms. Yesterday I had a real success with Orange Aboriginal Medical Service in providing an in-home testing solution for some of the community within Orange, where people particularly weren't able to leave their house for those tests, and so that's become a good solution, and thank you to Orange Aboriginal Medical Service for supporting that. We've seen a further increase in the number of patients in hospital. We now have 15 patients in hospital, 5 of those in intensive care and 2 of those ventilated. One of those patients is now being cared for in Burke. You might know we've done a lot of work to Burke Hospital and multi-purpose service in the last week to help with care for patients with COVID in the facility, and that's certainly taken a next step. 2 patients in Orange and 7 in Dubbo in the general wards. We've now got nearly 340 patients in our Care in the Community program, an incredibly successful program that's now seeing 24 patients discharged or people recover from their COVID illness, and so there's some positive stories in that. One of the new cases in Orange yesterday was a renal dialysis patient that was being dialysed in Orange Hospital on obviously a regular basis, and had contact with the previous case that we've announced of a case from Parkes that was being dialysed in that dialysis unit in Orange, and so we're taking some extra steps to make sure that we can test very regularly all of the other patients and staff in that unit and try and get in front of the potential spread in a really critical environment where we do need to protect some of our most vulnerable community members and patients. Again, we've seen another increase in the number of staff that are in isolation, 156 staff, and 21 of those through a workplace exposure. I'll come back later on this afternoon with some information around how to come and join the efforts in Western New South Wales Local Health District in helping us to keep patients in the community safe with a recruitment opportunity. Vaccination. Yesterday we saw over 1,700 people vaccinated through the ADF clinics in our vaccination hubs in Dubbo, Orange and Bathurst. 1,245 of those through the 3 locations the ADF were in yesterday. So can I say thank you to everyone that's coming out to getting vaccinated. I know there's big long lines and there's people really wanting to get vaccinated. Keep trying. But as Dougal said, there's a lot of opportunities for vaccination beyond the ADF clinics. with GPs, the Aboriginal Medical Services, the pharmacists and the respiratory clinics. The vaccination eligibility checker is a great tool to find out what's available in your location, what's suitable or appropriate for you, and how to book into those. And so please, everyone, the time is now to come and get them vaccinated. We'll continue the program right across the region and continue to expand that in coming weeks. I just want to give a shout out to our thousands of staff in Western Local Health District that are doing amazing things every day of the week in caring for patients in the home, in our clinics and in our hospital settings. We know that we've got some challenging times in front of us, and I know that our staff are just so incredibly dedicated to making sure that every patient gets the care that they need. Across Dubbo, Mudgee, Rylstone, Gilgandra and up through to Walgett, we are seeing a lot of the need for patients to be admitted to hospital beds, and so there are some pressures on those services. Can I please ask you to appreciate that our staff are doing everything to try and care for you and your communities. Some real understanding of the stress and pressure in those environments, particularly for anyone coming into a healthcare environment. Please show some love and understanding for everyone around you, and the behaviour and support for everyone across the whole of our region is just so crucial. It's a stressful time. Please, everyone across Western New South Wales, it's time to ask, how are you going? To one of your mates, one of your family members, one of the close people that you might know are being really challenged at the moment. It is a scary time for people. We want to help everyone through this. So as a community, we come together. So thank you for everything you're doing. Thanks, Jeff.
Thank you, Scott. Good afternoon, everybody. I think what often is lost in this whole process is the impact that COVID can potentially have on our healthcare system. And when you hear Scott talk about those numbers and the potential as we go forward, it does make it harder and harder to deliver normal services. So people are under pressure, and we just need folks working with us to make sure we look after everybody and look after each other. From a policing aspect, overnight we're still handing out a lot of infringement notices for movement around the region. Here in Dubbo, 50 infringement notices issued to people who weren't complying with the COVID orders last night. We also did around 170 compliance checks last night. When, just for your information, we have a list of people who are currently self-isolating as people suffering from COVID or close contacts. So we are regularly visiting those people with ADF staff, with wellbeing packs, with all sorts of bits and pieces to help these folks through their difficult time with COVID. Last night, 170 of those checks were carried out here in Dubbo. So there are police out there and our ADF colleagues all the time moving around our communities. If you're out and about without one of those good reasons, one of those proper reasons, there's a fair chance you're going to get caught, and 50 people got caught last night. The other thing about being out at the moment is the mask wearing. Dougal mentioned some issues we're seeing. Whilst outside, the regulation is now that you have to have a mask on if you're outside of your home, unless you've got a medical exemption, and by all means get that from your doctor and produce it when spoken to by police or others. But generally speaking, you must have a mask on when you're outdoors at present, and the police are obviously out there enforcing that current piece of legislation. It's a $500 fine. It's just not worth it. Please put your mask on, do it for yourself, do it for your family, and make sure we're keeping everybody as safe as possible. Our ADF extra police deployments are continuing in Wilcannia and Burke and Dubbo at the moment. Again, working closely with our colleagues in ADF to make sure we are keeping people as safe as we possibly can, but we need people to work with us. We need you to cooperate. We need you to stay home, stay put, stay where you are. Let's see this through, and make sure we're all there at the end of this current crisis we're facing. The local emergency management committees are meeting right across the region. My own region emergency management committee is meeting again today and we'll discuss with all our stakeholders any current issues, any difficulties we're facing, and problems that are raised we will try to address. There was one issue of concern raised earlier in the week down at Orange. I can tell you that 6 people who were COVID positive cases in Orange have now left Orange and moved back to their homes in the greater metropolitan area in Sydney. What they have done is probably caused at this stage a small cluster of COVID to break out there in Orange, which obviously Health are managing, and we are assisting through, again, that compliance process. That's about it in terms of a police update for today. I'm happy to take any questions online.
Thanks, Jeff. If anyone has any questions specific for Jeff, could you raise your little digital hands? We have one straight off the bat. Riley from the Central Western Daily.
Hey there. So you touched on it just then, the Orange tradies situation. I just wanted to confirm, was that the incident at the Molong Road 7-Eleven that they, at least some of them had broken quarantine, and that was the whole situation down there, or?
I'm not sure about the breaking quarantine, but it was the situation at the 7-Eleven, did involve that cluster that I'm talking about, Riley, yes.
Okay, cheers. And just yesterday, you also sort of mentioned, you touched on it a little bit. You said the community didn't need to worry about that. Why wouldn't the community, Orange, need to worry about? It's possible. You said it was part of the cluster. That's kind of signalling that it was probably some of the tradies breaking quarantine. Why wouldn't the community need to worry about possible breach of stay-at-home orders?
Yeah, I was talking about the situation itself yesterday, Riley, that specific situation. The police were there, the situation was under control, and I was specifically referring to that one yesterday. Of course, we need to be concerned about breaches of the COVID orders, and if anyone detects a breach or sees one, by all means, please contact the police and let us know, and we can deal with it like we dealt with the one yesterday.
Okay, cheers. And just sorry to follow up, were those 6 tradies, were they fined $1,000 each? Just wanted to double check.
Yes, they were.
Okay, cheers.
Cool. Thanks, Riley. Does anyone else have a question? Joanna, you have one for Jeff?
Yes, I do. Can I just get clarification on the 7-Elevens? I think there are 2 in Orange. The initial exposure site was the 7-Eleven on Bathurst Road, the Mitchell Highway, but then there's also one on Molong Road. Which is it? I think Riley did mention Molong Road. My understanding was it was the Bathurst Road. Thank you.
Thank you, Joanna. Does anyone else have a question specific for Jeff? Mariana, you have one?
Yes, I was just wanting to clarify that as well, because I'm pretty sure it's the one on Molong Road that's closed today.
Okay, look, we'll have to check that for you. When Riley mentioned that, I was trying to think exactly which one it was. So let us get that information for you, and we'll come back to you at the end of the press conference.
Thank you.
Cool. Thanks, guys. Thanks, Jeff. Does anyone have a question specific for Dougal? Could you raise your little digital hands?
I might just, while people are doing that, just quickly talk about venue for the pop-up clinic will remain at the Dubbo Regional Theatre and Convention Centre for the next couple of days. So today is Wednesday. It will remain here tomorrow, Thursday, and also Friday. The resetting up will happen at Pioneer Park for the weekend. So all of those people that are wondering what to do for tomorrow and for Friday, that vaccination clinic will remain at Dubbo Regional Theatre and Convention Centre and will be re-established at Pioneer Park for the weekend. And we'll be constantly messaging that, but just to clear that up. There's also been some questions coming through, particularly on the Facebook feed, about the stay-at-home orders. Look, there is a cabinet meeting happening this afternoon around the extension possibly of stay-at-home orders. I won't preempt what that might look like, but there'll be more information on that certainly by this evening or tomorrow morning.
Thanks, Dougal. Joanna, do you have a question for Dougal?
I'll take that as a no.
Sorry, I'm muting myself. No, I don't.
No.
Didn't even want to say oh hello. There you go.
Robin Heron from the ABC.
Oh, hi, Dukes. Just wondering if you've got any figures. It might have been been in the opening blurb around how many people have been vaccinated at that pop-up hub in the last couple of days?
Look, it's been roughly 600 to sort of 750 a day. Scott's probably got more details. I think he mentioned across the district yesterday it was over 1,700, but that included places like Warren and that sort of thing. But it's been normally it's been doing around 600 or 700 a day, which is fantastic. So we're encouraging people to keep doing that. But the other things are to talk to your pharmacists, talk to your GP. Not everyone will fit into the pop-up clinic. There's no doubt there will be more people to do, and there's huge capacity in our booked clinics, including our GPs and our pharmacists, to make sure we keep that rolling along as well.
Thanks, Dukes. Hamish, do you have one for Dougal?
Yes, I do. And you brought it up briefly about Cabinet discussing the lockdown and things this afternoon. I was just wondering, with the cases rising, it seems like the lockdown isn't really having the desired effect. I mean, how long do you think it'll take for us to bring down those cases, especially in Dubbo?
Look, yeah, I mean, Dubbo is obviously going through a period of deep concern. As Scott mentioned, we've got 35 cases from 8 o'clock last night. That's a huge concern. I'd certainly suggest that our particular region is very unlikely to be able to come out of lockdown. I think most people would expect that. It's more looking at some of the other areas of New South Wales that would be looking at whether it's appropriate or not. But the lockdown or the stay-at-home orders are there to help protect us, and that's why we have constantly said, please follow the stay-at-home orders, please do the right thing, because it makes it function in the way that it's supposed to by not spreading the virus. We keep talking about the fact that it's not spreading on the wind or with pollen, it's people interacting that spreads the virus. And you can say, yes, well, it's obviously at this point not working. Well, it is to a degree though, because if we did nothing, then there would be thousands of cases. We know that. By staying at home, we're protecting ourselves and our families. So I think that the idea that not having any impact is probably wrong. It's definitely having an impact. We need it to have more of an impact. Absolutely we do. We need vaccination rates to keep going up, and that's why we keep encouraging, get your vaccine whatever way you can. But in the meantime, the best thing to do is follow the stay-at-home orders in the best possible way you can each and every day.
Thanks, Hamish. Lynn Rayner from the Daily Liberal.
Good. Is there any further discussion on whether Dubbo is going to be declared a hotspot like the Sydney LGAs?
Yeah, look, I got asked that again yesterday. I literally spoke to the Deputy Premier again this morning. There are lots of added things that happen, different scenarios that happen if there are other areas that would be declared a hotspot. So it changes the way everything can happen. Things that are possible right now for certain businesses would not be possible under a hotspot declaration. So at this point in time, the benefit cost ratio probably looks like it is not the way to go at the moment. Can that change? Yes, it could. If things are deemed to be in such a situation that there is no other way out, and that's more of a discussion with the Chief Medical Officer and health districts to be working on that type of thing. If that is what it ends up being, then I guess we look at that when it happens. What we're doing right now is playing what's right in front of us, and at the moment, if people are doing what they can and following the stay-at-home orders, then we all have a chance to come out of this at some point as close as possible to now, but it relies on all of us doing the right thing.
Thanks, Dougal. Thanks, Lynn. Ryan Young from the Dubbo News.
Thanks, Matt. Yeah, I was just sort of following up on the lockdown questions and wondering, we have more cases in the Dubbo LGA than places like Strathfield and Georges River, and then their locations of concern where there's added restrictions. The case numbers aren't coming down. Why not act early and impose more restrictions? Because otherwise, wouldn't we just be stuck in this situation indefinitely?
Look, that's part of the balancing act. To be honest, it's about deciding what is right at the right time. So, when you're talking about Sydney area, Strathfield, Georges River, you look at density, you look at actual population density in those areas, and in places like Dubbo, even though we're a large inland city, the density of people is nowhere near the same, and so there are different scenarios that can happen. There are different ways of businesses operating. and providing services that can't happen in those more densely populated areas. It comes down to weighing up all those equations. At the moment, I think we're doing the right thing. I think we're doing the right thing by allowing people to have some level, some semblance of normality around business life. What that does is keep money in the economy, in the region. If we go into a further hotspot declaration, that tightens everything up. And yes, from a health perspective, that is probably the best scenario. I'm not sure that we're at that point just yet, but it will be looked at and it will keep being monitored with health advice, and also, I guess, balancing that with the needs of the community as well.
Thank you. And just one more. Have you sort of had people report to you ongoing concerns about, tests going missing at the showground and not being able to get results after, up to a week sometimes?
Yeah, look, obviously the tests and the results coming back has been something that I've been talking about, well, basically for 2 weeks now. This is 14 days on from when we at first went into stay-at-home orders, and it's been a constant problem. There have been some really good periods where there's no doubt results have been coming back super fast. We've had pathology testing clinics all around the region and in Sydney affected by isolating staff themselves. There have been reports of things going missing. I certainly haven't been able to verify that anything's been lost, but we do know that there are some absolute impacts from this on pathology units. There's certainly a program in place, and Scott can maybe address this a bit more, around providing more ability in some of our smaller locations directly in that town, but also the need to get those tests turned around as quickly as possible is recognised, and certainly there's a focus on that as far as forward planning goes, to make sure that the lag isn't there, because it's a really important thing to get right.
Thank you.
Thanks, Ryan. That looks like it for you.
Beautiful.
For you, Dougal. Thank you very much.
I'll just mention quickly before I go, Jeff McKechnie, the Assistant Commissioner, Western Region Commander, just confirmed it's the Molong Road 7-Eleven that we're talking about for all of the journos that were asking about that. That is the one that is being closed down and is the venue of concern. So I'll leave you with that and bring up Scott.
Thanks very much, Dougal. So we will run through one by one, as we did yesterday for Scott, starting with Lynn Rayner from the Daily Liberal, if you have anything.
I'm right, thanks.
Cool, thank you. Hamish from Prime 7 Dubbo, do you have anything?
I'm all good, thank you.
Good. Robin from ABC Western Plains?
Yes, Scott, you've said testing numbers are still not what you'd like to see. Do you have a figure that you'd like to see across the region for people testing? And are there any particular towns of concern that you would like to see those testing figures improve?
Thanks, Robin. Listen, we'd love to see about double the number of tests done every day than are being done at the moment. We've seen a decrease in a number of locations in the last week, and they're locations where there's active cases that in the last week or two have been infectious in the community. A couple of real focus areas at the moment, both Orange and Bathurst. There was an increase yesterday, but we've seen a reasonable number of the total cases have been infectious in the community in the last week. And so now's the time for both Orange and Bathurst and the community surrounding those to be really vigilant about any signs and symptoms, however mild, any concerns that you might have, the slightest sniffle, fever, scratchy throat, little upset tummy. Please come and get tested as quickly as possible. This is a crucial period for us to get in front of this.
Good, thanks, Scott. Let's move on to Ryan Young from the Dubbo News, if you have anything for Scott.
Thanks, Matt. I was just following up from what I asked Dougal about the testing. Did you have any info about what you're doing in smaller hospitals with maybe rapid testing, it sounded like, or something like that?
Yeah, Ryan, we're investing really heavily in some of the new technology that's able to do a really rapid test and with a good degree of confidence and quality around that. So in the last week, we've seen a what's called a LEAT machine, a really fast test machine, be delivered into both Burke, Walgett and Bathurst, and so that's been a great addition to our artillery of trying to test quickly and get people results that are qualified. We're looking this afternoon at a whole range of new technology that's about to come into Australia that'll enable us to do some mobile testing solutions that can drop into a community if we do have an outbreak or some cases identified, and rapidly test a large proportion of the population. So now that might be still a week or two away, but what we do have now is clinics in every town where people can get tested. Now there's been some concerns about the delays of a 2 or 3 day delay, and sometimes more, in getting some of those results back. It is continuing to improve, and with the decreasing numbers being tested in the region, there is capacity in our pathology services, and so please, can I encourage everyone to come and get tested pretty urgently if you've got any signs and symptoms, however mild.
Thank you. And lastly, just on the overall strategy here, is the goal to get to 70% of our region vaccinated before we can open up, nationally is the goal, or are you trying to get rid of the virus completely, and is that sustainable if that's what the goal is?
There's no question vaccine is going to be our solution to saving people from dying, saving people from getting really crook. The last thing we want to see is people ending up in hospital and on a trajectory that isn't good. As soon as you get really crook with COVID, it's hard to turn that around sometimes. Now, we've had some real success in the last couple of days in seeing patients discharged from hospital. But we know that vaccine is going to be the solution to saving people dying. It's the most urgent thing we can do as a community, is to get vaccinated quickly. I want to see Western New South Wales as the fastest and most highest rate of vaccination in the whole of the country, and I think we're on track to potentially do that. And we've seen it increase in the last couple of days quite rapidly. So we've now got, across the whole of the region, 54% of the community with a first dose and 26% with a second dose. Now that's increased by about between 7 and 8% in the last 2 weeks, and so that means a significant number of people have been vaccinated in the last 2 weeks. That's been a fantastic step. Disappointingly though, we've still got a very low rate of vaccination, and particularly double vaccination for the Aboriginal community across Western New South Wales. It's down at around 6.3%, and so can I please urge and ask all of the Aboriginal community, the leaders and elders, families, to come and look for vaccination opportunities. It is urgent. And we know that there's a large proportion of people that have currently got COVID are Aboriginal. We know that vaccination for our Aboriginal community is going to be one of the most crucial things that will help us save lives and save some of the most precious lives in our region.
Thanks, Ryan. So we'll move on to Mariana from Prime 7 in Orange, who has had to drop off, but she's texted me a question, Scott.
Sure.
Are there concerns there could be a large number of people who can't be traced, all linked to some of the recent exposure sites in Orange, due to a lack of QR codes at certain premises?
Thanks, Ariana. So we know that out of the 5 cases identified in the last 24 hours, 2 of those were definitely infectious in the community, and we're still contact tracing 2 more. Now, if we also relate to some of the other cases we know we've had in Orange, it's fair to say I think there is real potential and risk for broad spread transmission of this Delta strain. So I really would ask the whole of the Orange community to be on guard. Be aware that the person next to you in the line in the supermarket, in the service station, your kid that comes home in the afternoon, or your neighbours over the fence could be the next person that you spread COVID to or you pick it up from. And so some real urgency around the social distancing, mask wearing, QR code check-in is absolutely crucial. Our contact tracing teams get incredibly frustrated and concerned when we know that we can't get in contact with everyone that's been in a facility because there's CCTV footage or other things that tell us that people aren't using them. It's the best thing we can do to keep all of us safe, knowing where you are you at risk, and getting help and access to services quickly.
Thanks, Scott. Riley from the Central Western Daily.
Yeah, so just on the positive cases here in Orange, we know that at least some of them were employees from 7-Eleven stores here. There's also people saying, and last night's casual contact lists of a few fast food restaurants would also indicate that at least one of these cases is a food delivery right around town. Is this the case, or are you able to speak to that?
Yes, one of the cases identified yesterday was a food delivery driver. Now, our contact tracing and public health teams have done an assessment on how food was delivered. It's definitely delivered in a contactless way, as they all should be. It's not classed as a high risk point of transmission, and so that's not the area that we're concerned about. We're still doing some follow-up with how the food was picked up and any conversations and lingering time frames that we might need to be worried about there. So that work's still underway, and we'll continue to do that in the next 24 hours.
Okay, thanks. And the other question, just on that renal patient who was tested positive, can you update on what their status is? Are they on a ventilator, or what's sort of the go there?
So the renal patient that was picked up COVID in the renal ward in the last week is now in hospital in Orange, isn't in intensive care or being ventilated.
Okay, thanks for that.
Thanks, Riley. Maggie from the Parks Phoenix.
Thanks, Anya. Would you be able to give me the number of how many people got vaccinated yesterday in Parks at the pop-up clinic? And also, do you have a set target for the 3 days of the clinic of how many people you would like to see vaccinated?
Meg, I think the number yesterday was around 350. That was about the capacity of the ADF team and being able to get jabs in arms as quickly as they can. And so over the 3 days, something around 12 to 1,300 people I'd expect in Parks will get hopefully their first dose of Pfizer. But what I'd say is there's a lot of opportunity around Parks and surrounding communities for vaccination through the GPs, the respiratory clinic, the pharmacies that are vaccinating, and others that will pop up from time to time. So can I please encourage everyone, the ADF clinics aren't the only solution to being vaccinated. Please continue to look for those. I know not everyone in Parks and the surrounding communities will be able to be vaccinated through the ADF time in town. We really are going to need to keep really focused and attentive to trying to find appointments for vaccinations.
Thanks. And then my second question is, after the 5 cases that was announced on Monday in Parks yesterday and today, there's been no new cases. Does this, and those people were infectious in the community, does this mean that not enough people are going to get tested, or are people might be infected but they're not showing any symptoms yet?
I think what we can be certain of is that COVID could be lurking around Parks and the surrounding communities. We know that there's been people infectious in the community. We know that sometimes this strain of COVID can have symptoms come on very quickly, or it might take 2, 3, 4 days. And so for everyone, please, if you've got any signs and symptoms, however mild, come and get tested. The drive-through clinic at the showground is readily available, and so please don't hesitate if you've got any signs and symptoms.
Thanks.
Thanks, Maggie. Bradley Jerd from the Western Advocate.
Yeah, I just had a question about some of the cases we've had in Bathurst. Yesterday, we had a 7th case since last Friday reported, and that was after the 8 p.m. deadline on the Monday night. But there was no new cases announced for Bathurst today at the state government's morning briefing. And we've also looked at the New South Wales Health. They're saying there's now 8 cases in Bathurst. Are you able to shed a bit of light on that? Why the 7th case wasn't included in today's figures, and if there is an 8th case in Bathurst?
Sure, Bradley. So the case identified yesterday was included in the 8 p.m. numbers after that, so it didn't come out in today's numbers. The total number of cases in Bathurst at the moment is 7, so people shouldn't worry about the day-to-day reporting. The total number of cases is 7, and a lot of those cases have been infectious in the community. This is the most important thing for everyone in the community to know, is there's possible, and I'd say likely, future cases to be identified. We know that people will be becoming infectious in coming days from the interactions a couple of days ago, and so please, there's a real urgency to coming and getting tested as quickly as possible in Bathurst.
Okay, and the testing clinic that started up in Kelso yesterday, was that well received? Did you get a lot of people coming through there?
Yes, it was well received. We saw a lot of people come to get tested in Kelso. It really is an area of focus, and I really would encourage everyone in Kelso to come and visit that clinic. It's open 9 a.m. to 3 p.m. And so please, today there is some real urgency. Come out and get tested in Kelso and the surrounding suburbs.
All right, thank you.
Thanks, Brad. Oliver from the Canberra Times.
Thanks, Matt. Hi, Scott. My question surrounds the current situation going on in Canberra. I was just wondering what the latest updates are surrounding the currently active cases in the Canberra Shire and the places that they've been to.
Sure. So we are concerned about Canberra in the whole Shire. We know there's been a couple of cases in Gilgandra and one close to Canberra. Some of those have been infectious in the community, and so I really would urge some attention. If you've got any signs and symptoms, however mild, and please come forward and get tested. Please be aware that on every street corner, in every supermarket, in the service station or over the back fence, there might be someone with COVID right next to you, and so please take every precaution you can. This is the chance we've got to slow this down.
Great. And my second question, following the recent infections in the Canberra Shire, the local health district and Loxley Health have set up a pop-up COVID vaccination clinic at the Canberra Showground yesterday, and that's going to be open up until the end of this week. However, Loxley Health has reported in the last couple of days very few people have actually turned up to the clinic so far, citing further negative stigma around the vaccines. What message would you want to pass on to members of the community who may be hesitating to come to the clinic?
I'd say both Pfizer and AstraZeneca are very safe and effective vaccinations, and we've got those readily available in the community of Canberra and surrounding communities in coming days. Loxley Health are doing a fantastic job. They've got a team of people ready to go right now, and so this afternoon, don't hesitate. Come down. It'll be very quick, be very painless, and the best thing you can do is protect yourself and your family around you. So please come and get vaccinated.
Great. Thanks so much, Scott.
Thanks, Oliver. Kelsey from 2BS, do you have anything? Yeah, Kelsey? Maybe not, we'll move on. Come back to it at the end if we can. Xanthi from ABC Central West, who's stood in for Joanna, who's had to dip out.
Hi, Mr. Welcome. Thanks for doing it today. I'm just hoping you can give us a bit of clarification of a bit of a breakdown of the cases in the orange. So, one, how many active cases are there in the community? Can you give us a bit of a breakdown of those cases in terms of you might be told what the average was?
Sure. So we've currently got 12 cases listed, but take out the 6 of the gentlemen that have now made their way with police escort back to Sydney. There's 6 cases in orange. Now, we know that the vast majority of those have been infectious in the community in the last week. In the last 24 hours, out of the 5 cases, there was definitely 2 of those infectious in the community, and one of those was infectious for more than 48 hours. So those locations of concern that have been identified will probably continue to increase. So I can urge everyone to keep an eye on that information. If you have been in any of those locations of concern, then please come and get tested. Follow all of the advice, whether you're a close or a casual contact. But for everyone else in the community, this is not time to mess around. That this is time where COVID could be right next to you on any day of the week. We know it's lurking around the orange community, and there has been instances where infectious people have been in locations where there's real potential for spread. So can I please urge everyone, come and get tested if you've got any signs and symptoms. It's really urgent. We've got to get in front of this.
The Aboriginal community in Orange is there.
Sorry, I missed that. You might just speak up for me a bit.
Sorry, my microphone's playing up. Can you hear me?
Yeah, got you, Xanthi. Yeah.
Is the Aboriginal community in Orange, are you concerned about potential spread and transmission from the Aboriginal community?
Oh, we know that COVID doesn't differentiate. Aboriginal, non-Aboriginal, different races, beliefs, religious backgrounds. COVID will spread between anyone, and so that this isn't an issue just for the Aboriginal community or non-Aboriginal people. Everyone should be really vigilant and aware in this.
Thank you.
Very good, thanks, Anthony. Kelsey, I can see you're still on the call, so we'll give you one more chance unless you're having tech issues. think it might be tech issues or Kelsey's dropped off. So that's everyone. Thank you very much, guys, for attending again. Thank you, Scott, Dougal, and Jeff. We'll get that recording out to you as soon as we possibly can. Thanks again, guys.
Thanks, everyone.